your student nurse for today.
Okay.
Okay, I'm going to go ahead and provide privacy and do some hand hygiene.
Alright.
Okay, can you please state your name and date of birth?
Blake Bowman. My date of birth is 0225-2000.
Okay, and your doctor ordered me to take a full head to toe assessment. I'm going to go ahead and do that if that's fine with you. Okay, and are you having any confusion? No? Okay, and do you know where you're at today?
My house.
Your house? Okay, and you know what today's date is?
September 16th.
September 16th? Okay. And I see that he does have good eye contact. He does have good grooming. He has good vocal and speech clarity. And I do assess that his skin is within normal range. I'm going to go ahead and inform you on the Glasgow Coma Scale. And this is to assess any brain injury. So we do this using sensory, motor, and eye movement.
Okay.
And I would assess that he has no brain injury just from looking at those things. So I'm going to go ahead and assess your head. Can you sit up for me? Do you have any head trauma or you have any headaches lately? Okay, I'm going to go ahead and palpate his head. Okay, I don't feel for any abnormalities or lesions. Okay, and his head is symmetrical and so is his face. Okay, I'm going to go ahead and assess his ears. His ears are symmetrical. I'm going to go ahead and assess. I don't see any redness or irritation to both the ears. And are you having any loss of hearing? Or have you had any excess discharge of serum?
No.
No? Okay. I'm going to go ahead and assess his eyes. So his iris is green, his sclera is white, and his conjunctivus is pink. His pupils right now are a 5. I'm going to go ahead and check that with light. And I would say that they are 3. Okay, I'm going to go ahead and check for constriction. And he does have constriction. Okay, I'm going to go ahead and check for your accommodation. So can you please look at the tip of my pen light and follow it. Okay, he does have accommodation. I'm going to go ahead and check for his nose. Oh wait, do you wear any contacts or glasses?
For contacts.
You wear contacts. Okay, and when was your last eye appointment?
February.
February of this year?
Mm-hmm.
Yes, okay. I'm going to go ahead and assess his nose. His nose, just from looking at it, looks symmetrical. Do you have any history of trauma to the nose?
Not that I know of.
Not that you know of. Okay, I'm going to go ahead. And I do see that he does have a deviated septum. So I'm going to go ahead and document that and then let the doctor know. I'm going to go ahead and assess his lips. And his lips are pink and moist. Can you please open your mouth? He does have good oral hygiene, and his inner mucosa is pink and moist. Have you had any soreness to the mouth lately? No? Okay, I'm going to go ahead and assess his neck and throat. Do you have any neck pain? No? Okay. His trachea is midline. Do you feel any tenderness? No? Okay, I'm going to go ahead and assess his swallowing. Can you please take a sip of water? Okay, and did you feel like that was difficult or any pain swallowing? No? Okay, and I'm going to go ahead and check for any venous dissemination. Don't see any right here. Okay, and I don't see any right here. Both these right here, your carotid. I'm going to go ahead and go down right here near your armpits is your axillary pulse, and then down right here is your brachial artery pulse, and this is mostly used for blood pressure. Right here is your radial, your ulnar on both sides. I'm going to go ahead and palpate the wrist at the radial. Okay, and I did notice that his radial pulse on the side was a +3 strong, and his respirations were a 20. I'm gonna go ahead and palpate the other radial pulse on this other side. Okay, and I would say that's also a +3, really strong. I'm gonna go ahead and check for any edema in the arms. Okay, I don't feel for any edema. I'm gonna go ahead and check for capillary refills. And they do go back every 2 to 3 seconds. Okay, I'm gonna go ahead and do passive range of motion to his elbows. And do you have any trauma to either elbow that I can't do this range of motion on you? No? Okay. I'm gonna get you to go ahead and flex, resistance, okay, extension, resistance. Okay, and then he would hyperextend. Okay, I'm gonna do the other side. Can you please flex for me? Okay, resistance. Okay, extension, resistance. Okay, and then hyperextend. I'm gonna go ahead while I'm here and do the wrist. So can you please flex for me? Okay, resistance, extension, hyperextension, resistance. Okay, I'm gonna go ahead and do the other. Okay, please flex, resistance, okay, extension, and then hyperextension, flex. Okay, and then I'm gonna go ahead and tell you this is your femoral pulse. Behind your knees, your popliteal pulse.
Okay.
Right here at the ankle is your tibial. I'm gonna go ahead and palpate this. I would say this is a +2. The other side, +2. We go ahead and do the Dorales pedis. I would say it's a +2. And then the other side, I would say that's a +2 as well. I'm going to go ahead and do some passive range of motion on his knees. Do you have any trauma to the knees at all where I can't do the passive range of motion? Okay, can you go ahead and flex for me? Resistance, extension, resistance, okay, and then hyperextend. I'm going to go ahead and do the other side. Can you go ahead and flex for me? Resistance, okay, extension, resistance, okay, and then hyperextend. Okay, I'm going to get you to go ahead and stand up for me. Okay, and I'm going to go ahead and do range of motion, passive range of motion to his hips. So, okay, put your feet together. Okay, and abduct. Okay, and then resistance with abduct. And then abduct, resistance. Okay. I'm gonna go ahead and do the same thing on the other side. Okay, abduct. Okay, resistance. And then abduct. Okay, resistance. Okay, now I'm gonna go ahead and assess his gait and balance. So I'm gonna go ahead and get you to stand over here. Okay, and I'm gonna go ahead and get him to walk all the way over here for me. Okay, then walk back for me. Okay, now I'm gonna go ahead and get him to do a heel to toe walk. So I'm gonna go ahead and get you to do that. Okay, and you can turn around and come back this way. Okay, I'm gonna go ahead and assess him back to his chair. Okay, you can sit back down. And his gait and balance were excellent. Okay, now I'm gonna go ahead, and did you have any pain while doing that at all? No, okay. Now I'm gonna go ahead and assess your lung sounds.
Okay.
And every time my stethoscope touches you, I'm gonna get you to go ahead and take a big deep breath in. And before I do this, are you having any pain or struggling to breathe lately? No, okay. I'm gonna start at the right upper lobe. Left upper lobe. Left lobe. Right middle lobe. Right lateral or lower and then left lateral rollover. Okay, I'm gonna go ahead and assess his posterior at the right upper lobe, left upper lobe, left lower lobe, and right lower lobe. Okay, you can go ahead and sit back. Okay, and I didn't hear any abnormalities in the lobe sounds at all, so that's great. If I did hear any abnormalities, I would use the bell. So I'm gonna go ahead and get you to cough for me. Okay, and that was a short, dry cough, and I did not see any sputum on the outtake. So I'm gonna inform you for some deep breathing, turning techniques. So if you just get up, move around, turn, take a big deep breath in, and then let it back out and cough. It does help with lung expansion, so I definitely recommend you to do that.
Okay.
I'm also going to show you the insensitive speedometer. This piece right here goes in your mouth, and you're going to take a big deep breath in, hold it for 5 seconds or however long you can, and then breathe back out. This does have a ticked milliliter sign for how much you can do of the dosage the doctor does prescribe you. You do this 10 times per hour while awake. Okay, and then I'm going to go ahead and assess his cardiac heart sounds. So I'm going to go ahead and start at the right upper intercostal, second intercostal space at the aortic. And then the left, second intercostal space, the pulmonic. Ernst point, tricuspid, and the mitral or apical. And I would assess the mitral or apical pulse for a full minute with just skin contact. And are you having any heart problems, like a racing of the heart? And do you have any history of heart problems? Okay. And I'm going to go ahead and get you to lean back. I'm going to go ahead and push your chair out. I'm going to go ahead and get you to lean back. And can you please expose your abdomen for me? With this, I'm going to go ahead and assess his abdomen. I see just by looking at it that his skin is within normal skin range. He doesn't have any cyanosis. I don't notice any dissension and no lesions or cuts or anything like that. So I'm going to go ahead and osculate his 4 quadrants. So I'm going to start at the right lower quadrant and assess for any vowel sounds. Okay, and then I'm going to move up to the upper right quadrant. Okay, and then the left upper quadrant. Okay, and then the left lower quadrant. Okay, and I didn't hear any abnormal vowel sounds. If I did hear any abnormal, it would be hyper, hypo, or bruit. I'm going to go ahead and percuss his 4 quadrants, and please tell me if I'm causing you any discomfort or tenderness. Okay, I don't feel any deformities of the abdomen. And again, I don't see any dissension. I'm going to go ahead and set you back up. Okay, and then I'm going to go ahead and ask you when your last bowel movement was.
Was that yesterday?
Yesterday? Okay, and are you having any excess flatus or excess gas? No? Okay. And are you having any urination problems? So you excessively urinating or any pressure to urinate? No, not at all. Okay. Well, I'm going to go ahead and document this and let your doctor know, and he'll be here shortly.
Good, thanks.
You're welcome.